High blood sugar, also called hyperglycemia, can become a medical emergency if left untreated. Knowing the warning signs and when to seek help could save a life.
What is high blood sugar? High blood sugar happens when there isn't enough insulin. The body can't use insulin properly, illness increases blood sugar, or diabetes medication is missed. Blood sugar levels rise above the normal range and can lead to serious complications. Common warning signs include 1. Extreme thirst. 2. Frequent urination. 3. Dry mouth. 4. Blurred vision. 5. Fatigue or unusual weakness. 5. Headache. 6. Nausea or vomiting. 7. Fruity smelling breath. 8. Deep. 9. Rapid breathing. 10. Confusion or drowsiness.
When to call emergency services. Call emergency medical services immediately if the person 1. Becomes confused or difficult to wake. 2. Has trouble breathing. 3. Is vomiting repeatedly. 4. Has fruity smelling breath with rapid, deep breathing. 5. Loses consciousness. 6. Has very high blood sugar with worsening symptoms. These may be signs of diabetic ketoacidosis or hyperosmolar hyperglycemic state, both life-threatening emergencies.
Remember, don't ignore persistent high blood sugar. Encourage the person to follow their diabetes treatment plan, drink water. If they're awake and able to swallow, check their blood sugar if possible, and seek urgent medical help when warning signs appear. Early action saves lives.